So the title of my research project was Causes of Postpartum Depression, Leading to Effects and Finding More Information to Help Decrease Postpartum Depression and Prevent it. So as you all know, hopefully, my name is Marissa Finley. My college is nursing, and my mentor is Dr. Julie Schwinn. So before I go to the next slide, I just want to ask you guys the questions again that I asked you before. So do you think that being a parent is difficult?
Yes.
Do you think that once you have a baby, you have an automatic bond with your baby?
No. Yes.
No.
Yes. And do you think that an arrival of a new baby can cause such an impact on you that you may want to hurt the baby or yourself?
No.
Yes.
Well, those were the questions that I asked myself when I was going to start this project. So here's a video of the effects. Wait. Here's a video of the effects and what can cause postpartum depression.
How to detect the symptoms of postpartum depression. Postpartum depression is more serious than the typical baby blues that can occur after childbirth. Learn how to identify this condition so you can treat it and spend more time enjoying your baby. You will need knowledge of the symptoms and medical attention. Step 1. Take note of constant feelings of sadness, shame, inadequacy, or emptiness that continue past the first 2 weeks after childbirth. Step 2. Look for loss in appetite or a drastic change in weight. Step 3. Think about whether you lack energy or motivation, or have difficulty completing tasks. This condition often results in a loss of pleasure in anything about your daily life. Step 4. Watch for signs that you may be having difficulty bonding with your baby, family, or friends. Step 5. Be aware of thoughts about harming yourself or your baby. Step 6. Understand that postpartum depression does not mean you're a bad mom, and know that there is help available. If any of these symptoms are present, talk to your doctor immediately. Did you know? After childbirth, 50% of women experience baby blues, a temporary depression that usually goes away within 10 days.
So, as you guys saw, those were symptoms of postpartum depression. And if you didn't know what postpartum depression is, I'll tell you in a little bit. So my purpose. This is my my problem statement, but so I thought of myself as a nurse. I wanted to educate mothers on preterm labor and how it can affect postpartum depression and kind of educate them on stress too. But I really wanted to focus on ages 15 to 30, the younger crowd though, not really the older crowd, because I felt that they had a lot of knowledge on it already. I also wanted to research preterm labor affecting postpartum depression. So this is the 6 stages of postpartum depression. I took this right off the internet, as you can see my source right there. So the 6 stages: denial, anger, bargaining, depression, acceptance, and PTSD. So denial is when you're thinking like, okay, I don't have postpartum depression, this is just something that'll pass. Anger is when you feel like, oh, nobody doesn't understand what I'm going through, I just had a baby, they don't understand me at all. Bargaining is thinking like, oh, well, maybe if I hold my baby, or maybe if I go out and do the laundry, I'll feel better about myself, and maybe this thing will pass. Depression is when you feel depressed, basically, and you don't want to do anything, you feel like your baby doesn't love you, and you feel alone. And acceptance is when you're actually accepting the fact that you have depression, and you're like, okay, I have depression, I need to go get help for it. PTSD is post-traumatic stress disorder, which means you already had postpartum depression, but you don't want it to come back. So the background information. These are just some key terms that I wanted you guys to know. So postpartum depression, if you didn't get it before, is a state of depression that occurs after the first couple of days after birth when you have no interest in the baby or yourself. Now this can occur longer than a couple of days. It can occur for 6 months, I've read. Single mothers may be a different way how I define single mothers to you. So the way I defined it was a single mother who doesn't have a husband, a boyfriend, or a significant other helping them with their children. They may have a friend or a mother or a dad, but specifically not somebody who's going to be there in a love. I can't really say that. And then minorities, I only chose African American and Hispanic since I'm African American and Hispanic. So 3 sites. I'm only going to read the bolded Non-Black mothers reported initially higher symptoms. I highlighted this quote because it talks about minorities basically having a higher chance of getting postpartum depression, such as stressful events. This quote talks about factors leading to postpartum depression, and I wanted to focus on stress leading to postpartum depression, so such as stressful events. Again, down here it talks about leading to postpartum depression, stressful life events, and lack of social support. I highlighted lack of social support because that's what I wanted to do for my intervention. My methods. I had 25 women. They had to be African American and Hispanic, or either or. They already had to be diagnosed with postpartum depression, or they had to be associated with it. And the survey was about preterm labor, nurse, health, your age, and more education if you wanted. So here's a picture of my survey. My letter, you can't really see it, but I have it up there. And then my questions. So these are my results. You guys seen these before. And then I didn't know how to do a 2x2 table, so I did a 6x5. So I felt that everything, these were all my questions, so I felt that they were like really important. But then I did my 2x2 table. So my relative risk factor is a group of women that are older age are 12% more likely to decide that they want education on postpartum depression. So here's my overall results to each question. So in conclusion, the older you get, the more education you want. So this really surprised me because I really wanted to help the younger kids because I felt that, since they don't really know that much about postpartum depression, they would want to learn more and try to prevent it. But when I asked them, which were my friends who has kids and who went through postpartum depression, they were like, oh, it's just something that happened to us. We don't really care about it anymore. It's not going to happen again. They just don't understand how important it is. So my strengths. I knew the population that I wanted and I knew what I was asking them. My limitations was the fact that I wanted to educate the younger women, but they didn't want to be educated. My comparison to the results was the minorities are more able to get postpartum depression than the others. My quantitative, which surprised me, was that ages 19 through 25 received more help from their nurses during postpartum depression, like the nurses helped them cope with it and deal with it if nobody was around. And they still wanted more education on postpartum depression. And if I could have continued further with this experiment, then I would have definitely added some more minorities in there to see what kind of trends I'd get. So my intervention was postpartum depression meeting. It's kind of like an AA meeting where you talk about your feelings and how postpartum depression has affected your life. So I wanted to do something like that so they can talk about what's going on in their lives and maybe it'll make them feel better because I really don't believe in using drugs to help your problems. So free daycare, I was either going to provide a free daycare or free child care. So, because my sister, she has 3 kids, so I know that she's always worried about where they're supposed to be. So I thought if my sister was in this position, I know that she would want to be with her kids the whole time. So I provided a free daycare. So the support group discussion, basically you're just in a group. Everything is confidential, nothing is going out. But the spreading knowledge, I do want the women to spread the knowledge saying like, telling their friends, it's okay to have postpartum depression because I've been there and I can help you if you just come to this group. So here is a video about solutions if you have postpartum depression. And I'm only going to show you like the first part. Since I'm running low on time.
Hi everybody, I'm Melanie Raposo and welcome to Mommy's Minute. If you're experiencing postpartum depression symptoms that are lasting more than 2 or 3 weeks, it's time to seek professional help. Here are some treatment options that your healthcare provider may suggest. First, joining a support group is a great idea. Being able to talk to other women who are experiencing the same things you are is always reassuring. Recent research shows that antidepressants and talk therapy combined can also be very effective in eliminating postpartum depression.
So as you can see, she talked about joining a support group, and that's what I wanted to focus on the most. So here's my references, and are there any questions?